I'm going to give you a little theater. I'm supposed to talk about government. Well, this is what you don't want your government to do. You don't want your government to say, we want you dead. What I want our government to say is, I want you to rid my country of what's killing our citizens, asbestos. And to do that, the government and the people can speak until they're blue in the face, but without getting its citizens to convince the body that makes the laws for the people, by the people, and of the people, this is not going to happen. And ADAO actively is getting the people and going for the people to speak to this agency. However, until that body takes action to ban asbestos, we are going to continue to see asbestosis deaths, as shown on this chart from NIOSH, to have risen 20-fold between 1960 and the 1990s and are still very high in our country. In Canada, which we've just heard about, the mesothelioma deaths are still increasing from 1984 to 2003. The World Health Organization estimates that some 90,000 people die annually from disease related to occupational asbestos exposure. 43,000 to mesothelioma, 39,000 to lung cancer, and 7,000 to asbestos. Unfortunately, very large parts of the world lack data on mesothelioma and mortality incidence experience. Are asbestos-related diseases a pandemic? What is a pandemic? A pandemic is the excess occurrence of a disease in a large portion of the world. H1N1, which we're all familiar with, the pandemic, this so far has experienced 14,142 deaths, and this is an update from the WHO. But 90,000 people die each year around the world of asbestos-related disease. And that 90,000 figure is probably a large underestimate, because we don't include other cancers such as larynx, ovary, colon, and other gastrointestinal cancers. This is kind of a hard slide to see, but I put it up for one purpose, and that is the relative inhalation toxicity of chemicals that are listed by the Environmental Protection Agency. Asbestos is number one, and if you can see that figure, it's the highest figure because the range of toxicity weights is approximately 0.01 to 1 million. Asbestos is right at 1 million. The next chemical, bischloromethyl ether, is 48,000. So this is a big difference that asbestos is still a problem in the United States in the emissions that are coming out. This you've seen from other slides, but this is just trends in world production. As you can see, it's gone down a little bit, but it's been fairly steady in the last decades or so. And where is it going? I think we've heard about this, but if you look in Europe, it's going down. North America, it's gone down with regulation, but in Asia, in the Asian countries, it's going up. You saw Ferdinando's slide going to, I think it was Sri Lanka, the shipment. And so we still have a major problem with asbestos in the world. What many of the pundits tend to tell us, like our favorite, Rush Limbaugh, there are two types of asbestos. One is potentially lethal, and one is as harmless as a cheese doodle. The cheese doodle variety of asbestos is known as chrysotile. It accounts for 95% of the asbestos used in the United States, and it is utterly, totally harmless. Well, the government can even make some mistakes every once in a while, and we have to keep a vigilant watch on our government and what the government does. This is a government publication, Environmental Health Perspectives, came out in March of 2010, where a paper was presented about current and future mesothelioma epidemics in Hong Kong, the tragic legacy of uncontrolled use of asbestos in the past by some Chinese authors. And then their conclusion, you can see, this is the paper's conclusion, that the present study provides supportive evidence for an immediate and global ban on asbestos use. Well, the editor of this government journal, United States Government Journal, in his summary of this paper stated about chrysotile, which this paper talks about, it may not decrease the background risk levels given that chrysotile consumption has not been banned, and the paper calls for a ban. Well, this government author says about chrysotile, which has been implicated but not conclusively established as a cause of mesothelioma. That's in direct contrast to what the International Agency for Research on Cancer published in the same month of last year, March of 2009. So what can the government do? I'm picking from the UK, but I thought this is appropriate. The government can drive home the facts. They can tell the truth. And they can tell, such as in the UK, where every week 4 plumbers die, 20 tradesmen die, 6 electricians die, and 8 joiners die. All of this from this hidden killer. They go on to say that the government can answer these questions. Why is it dangerous? Where can you find asbestos? What does asbestos look like? Am I at risk? And how do you protect yourself, or I protect myself? These are the things that your government should do and can do. And we look to our government to do it. But as I said, we also have to look at what our government does do as to what they should do. And we have to call them on that when they don't do the right thing. So what can the government do? They can give the facts. As Sergeant Joe Friday on Dragnet said, all we know are the facts, ma'am. So clean up our factories, homes, and environment. Get rid of the silent killer. Do away with asbestos. Ban its use. It's everybody's job. Thank you.